Hi, this is Real Life with Dr. Ebi. And for those of you who've been following my channel for some time, a few episodes ago, I talked about infertility in men. I talked about the reasons men could have infertility, talked about the risk factors, things that can predispose men to infertility. But today, I want us to look at infertility in women or subfertility in women. But I want us to look at it from a very personal perspective. So guess what? We have our very first guest. She's a friend, she's a mother, she's a colleague. Her name is Dr. Jaja. Hi, Dr. Lily.
Hello. Thank you for having me.
You're welcome. Thank you for coming to share your story.
You're welcome.
I know there's a lot of women who are on the same journey with you, but cannot share the story, probably because of their family, their profession, or even just society's perspective on infertility. So thank you once again for agreeing to come on Real Life with Dr. Ebi.
You're welcome.
Okay, so let's dive right into it. I have a couple of questions I've written down, but I just want you to express yourself in the best possible way so people can really relate to what you and a million other women are going through.
Sure.
So I have the privilege of knowing that you're already a mother, so
Yes.
a very intelligent 5-year-old, soon to be 5-year-old.
Yeah.
So tell us first, how was your journey to being a mother, a first time mother?
Truthfully, it was really easy. I'm not gonna lie. Like, I got married in December, and I think by February, I was pregnant. So it was a very easy journey for me at first, and I felt like that's what's going to continue happening. You just get married, get pregnant, and pregnancy was easy, had a baby. So I wouldn't really complain or have any reservation about the first time I was pregnant. It was a breeze, to say the least.
Okay.
Yeah.
So during the journey, was there anything during the course of your 9 months? Was there anything that pointed to any issues? Did you predict that there was going to be anything? Did you point out anything because of pregnancy?
Absolutely not. Absolutely not. I mean, pregnancy was easy, like I said, and throughout the course of the pregnancy, I think I only felt ill once. I was just like malaria, so I didn't have any problem. There were no complications during delivery. Yes, I had prolonged labor, but it was still an easy piece because I ended up with a C-section, healthy baby, healthy mother. So there was nothing that would pinpoint that I would in the future struggle. Yeah, so there was really nothing.
Okay. So for some people, a lot of people don't know this. You're a doctor, so I know you understand. Infertility is like there are two things. Some people are just unable to conceive for many reasons. Men who have anospermia, women with, distorted uterus. So many reasons why people, hormonal problem, genetic problems.
Yeah.
But I've realized in some parts of the world, a lot of the issue is subfertility. So the issue is not conception; it's just difficulty. So some people have already had children, but have difficulty having children after, the initial pregnancy.
Yeah.
So for you, how has this journey been? Getting pregnant or going to attempting to have your second child? How has it been? The highs, the lows, the mental, physical, societal, emotional struggle. How has it been?
Wow. Well,
I know.
That's a very interesting Well, for starters, it's not been easy. I'm not going to lie to you and say it's been a breeze. I've been okay. No, I've been emotionally, mentally drained. It's been, like I said, I got pregnant easily the first time. So in my mind, once I just do anything or get ready to get pregnant, it was going to happen. And then the first month I'm trying happened and nothing happened. The second month, I'm like, okay, maybe because I actively prevented pregnancy for like 2 years for the case. After my first child, because I was trying to do family planning,
Okay.
But I said, okay, let me give myself like 6 months, and it didn't happen. Now that was when I started getting worried because now, everything just sets in. I'm like, okay, am I having a problem? Is there something going on? Like, yes. So I'm like, wait, what is going on? And then I said, okay, let me try and just not think about it. But it was a lie. I couldn't not think about it. Every month that I had a period, I would cry myself to sleep. I would sit on the floor and just cry. and it was very hard because I was talking to people. I'm like, oh, if you do this, do that, you will get pregnant. And then it wasn't working for me. And I did everything that first period. I did even down to the Clomid, and I was reacting to every medication that should have helped me, ovulate faster. It wasn't, so nothing was working for me at that point in time. And I had to even go back to my doctor. I'm like, did I have a problem? Like, what is the problem? Is that, Lily, you need to try harder. It's not been a long time. But the one thing that got to me each time, and this happens to some women, is the premenstrual syndrome, where I would have full-blown symptoms of pregnancy. I don't know if I'm allowed to say it.
Feel free.
Okay, so your boobs are fuller and painful. They're tender. I'm eating like a cow. I'm hungry. I'm nauseous. I'm sleeping a lot. And then my period is late. So in my mind, I'm like, oh, okay, this is happening. Few days later, my period comes heavier than before, and I'm literally a wreck. I would sit down. I'm like, God, what is this?
In your head, you're thinking,
maybe it's, and I'll do so many pregnancy tests when it's late, but I mean, it wasn't happening. And that was the thing that hurts me the most, because I would have been fine if my period came same time every month. I won't have a problem, but putting me through that process of thinking I am, and then I'll find out I'm not. It was the hardest thing. But I feel like the one thing that helped me was my husband. He'll be like, Lily, that's fine. Even if it's one child, it's fine. But as a Nigerian woman,
we know it's not fine.
It's not fine. I mean, he personally, to the best of my knowledge, doesn't have a problem with it. But society, people be like, oh, don't you want to have another child? What are you waiting for? You don't know that I'm trying and it's not happening, So I think that was the most difficult part for me. Family was supportive, and my spouse was supportive. It was more of societal pressure. That's really
a lot. I can imagine. So the thing is, as a doctor, when you interact with women who are going through the struggle, when they tell you, oh, doctor, I'm trying to pregnant, you just need a little bit of history and you realize that they're actually not trying, because you had to have had unprotected sex for at least a year. Some people have not even tried for like 6 months. I'm trying to ask, okay, how long have you been having sex? Oh, sometimes we do once a week, twice a week. I'm like, how is that going to happen? But then there was something you said that I picked on, and I just wanted to, come back to. You said if your period came at the same time every month, so that means there was some inconsistency in your period, because that's another reason that people, experience difficulty in conception, hormonal issues.
Yes.
So did you have that initially, or did that happen after your first pregnancy?
Truthfully, I had that initially. Okay. However, it did not stop me from getting pregnant. So yes, I would have the high estrogen and have some bleeding here, there, but it really didn't affect me, conceiving the first time. So I didn't feel like it was going to be an issue until now. So truthfully, I would say yes, my hormones are out of whack, but it's not significantly high enough for me to worry so much. So I'm still, working with my doctors to know, okay, what exactly is the problem?
Whether there's a problem as it has to getting pregnant, or as opposed to the hormonal issues, or have you been given a proper diagnosis as to issues with the hormones?
I mean,
officially,
truthfully, I've not been given, it's been going from one diagnosis to the other. One time, oh, you might have adenomyosis, and then we do all the tests and it's not it. Oh, maybe endometrial hyperplasia, and you will do all the tests and, oh, okay, no, I think it's fine. Okay, let's rule out PCOS, and then I do a scan. Oh, there are no cysts. But okay, let's check. Testosterone is fine. Oh, it's the estrogen. So it's
neither here nor
there. Yes, exactly. And that's more frustrating, because if I even knew what was wrong, then I can proactively find a solution. You get? So it's been here, you're just here, there. But truthfully, like I would say, I wasn't the people might see me and say, oh, your child is almost 5, so you've been trying for 5 years. I wasn't trying for 5 years.
Okay. So how long have you been actively trying?
I would say 2 years. I would say 2 years, because the first 2 years, I obviously didn't want to get pregnant. And then the next year, I wasn't actively trying as much as I should. Okay. So I wouldn't blame any other person than myself. it was now the next 2 years. Okay, let me actually try by the books, follow the books and see what will happen. So yeah.
So now, I'm sure you're talking to your doctors. You're a doctor yourself, so you know the medical aspects of all of this. So in all of this, like you said, now we've talked about being a Nigerian woman. You can't rule out the pressure of the society. In fact, in general, you understand, because there's people feel like they have a timeline for your life or when you should achieve certain goals.
Yeah.
And it's like, oh, why aren't you married at 30? Why don't you have a child at 30? If you have a child, why do you have one child? There's always this question.
Of course.
So now, getting to this point, you said family has been supportive, which is great for you. Not a lot of women can say that their family has been supportive.
Yes.
But like I said, there will always still be that pressure within yourself to say, okay, I want to have another child early.
Yeah.
But now on your own, like, what are the options you've explored medically? What options have you explored? What options have you looked at? And what do you think is likely to be your best option right now, given the circumstances?
I mean, for me, I've explored medications, hormone therapy.
You mentioned
yes, and because of my history of allergies, I mean, I'm the 1% of the people that will get the side effects. So that was out of the question for me. But presently, I'm more tilting towards IVF. Okay. I feel like that would be a better option for me if my doctors clear me to do so, because you would still have to have some hormone therapy. So if I'm able to, contain the side effects and all that, that would be a good plan. That would be a good plan for me. But for now, I just want to get to the right mental space to handle everything.
The process.
Yes, straightforwardly, because it's not going to be an easy process. Mm-hmm. And the fact that you're doing an IVF doesn't necessarily mean it's going to work. Yeah. So I have to also have my mind set, even though I'm positive. I really need to get to that point where I'm mentally strong to go through the journey.
Okay, so for a lot of people, the options are there, but everybody just generally tilts towards IVF. We know that there's intrauterine insemination.
Yes.
We know that that's less invasive.
Yes.
But then, I don't know why we like to just generally play around with embryos and eggs. Why do you think, now this is a question for you, just as somebody who's going through it and also being a doctor, why do you think people just always settle on IVF? Why do you think people just go for that option straight up? Like, they don't want to consider other options. Yeah. You understand? Like, you already tried Clomid, which is a hormonal therapy.
Yes.
You already tried to maximize your chances. They're not, they just want to, because, I mean, think about this. The cost of IVF everywhere in the world
is expensive,
is outrageous. So I'm wondering why people are just delving right into IVF. Why do you think that is happening?
Personally, I think it's for two reasons. One is majority of the women I've spoken to about secondary infertility, subfertility, and all that. Most of them have tubal deformities, or they had an infection that wasn't treated properly. Their tubes are blocked. So they want to, or taken out, or I've had ectopic pregnancies and all that. So they just want to skip the whole process of if we will fail or not fail, or if your tubes are patent or not, and just go right to it. Another reason is because people can control, they tend to believe that they can control the outcome because of the multiple embryos that are being implanted. So at best case, maybe one will stay or two, according to them.
There's the part of
yes, you get to do the selection as well. So I think that's why people tilt towards the IVF more, even though it's not 100% guaranteed.
Yeah, because we still know that people have gone through cycles and cycles. Like you said, you have to mentally prepare for the process. And some people have gone through cycles and cycles and cycles of IVF and it still didn't work. So I've just always wondered, maybe I felt like because you're on the journey, you probably would have met people who are on the same path.
Yes.
Probably would have asked questions and everybody's like, oh, we're doing IVF because of X, Y reasons. So like I said, I had a couple of questions. Sorry.
Sure.
So now, what do you think, now as a doctor, as a woman, what do you think you should or would have done differently to predict? Now, we can't, nobody's all knowing.
Yes.
But do you think there's anything that you could have done to change this particular outcome? If you had decided to try faster, like you said,
yes. I think I always ask myself that question. would they have been different if I had a child almost immediately, if I tried almost immediately? Because then I have a problem conceiving. Is it the long time I spent, doing family planning that was the reason why I'm not conceiving now as I want? So that question is always there, and I don't have the answer to that. I wish I tried that, but truthfully speaking, I'm not sure I'll still do that. I'm not sure I'll still do that, because I'm a firm believer of giving your best. So I wanted to be there, present for my child, and care for him wholly, you understand, and be present in his life. Not the one that I have a small child and I'm struggling with another small child and I'm giving half an hour. Yeah, it's almost like a staircase, you understand? Yeah. So I wanted to be very present in his life, and I wanted to go through milestones with him in details. So I don't think I would have done that, but that question is always lingering above my head. Like, okay, would it have been easier if I had, tried to conceive just as soon as I had that baby? But deep down, I wouldn't have done it, sure.
Because you just feel like it would have been too much for you.
Yeah, it would have been.
But then I think a lot of women will also have that question.
Yes.
There will always be that, okay. Because I don't think some people were even doing family, because yours is different. You're doing family planning. Mm-hmm. I've spoken to a couple of women, and it's not really about family planning. Some people say we're doing family planning, but they're having unprotected sex. And you're not going to give birth to a television. It's still going to be a child. Yes. So if you're actively planning, you need to be actively planning. So when people say, oh, I'm doing family planning, I'm like, okay, so are you having unprotected? Yes, once in a while. When I'm like, it's not the same thing. But I understand where you're coming from. You probably would have thought, okay, as if I had done this early when everything seemed like it was good. Yeah. But the truth is, you never know. You never know. I think, like you said, that question will just keep hanging over your head. And I think there's a lot of other women that will also be asking this question: what exactly could I have done differently? Mm-hmm. But then, being on this path, I know it's tough. I know it's hard, because, like you said, you have to mentally prepare yourself for the journey.
Yes.
I want what I want, but I'm not getting it when I want. And I think ultimately, not all women, I don't think everybody's cut out to have a child. Yes. But I think naturally women have an instinct. So yes, that motherly instinct is always there. Everybody wants to be a mother.
Yes.
So I feel like a lot of people want to know, what can I do to make my own situation different? What would be your advice for people that are going through similar, path or on this journey as well? What do you think? Now, I want you to really think about it, because there's a lot of people watching and thinking, okay, what's she going to say? Is my answer in there? So really think about your answer and then tell us, what is your advice for people or for women that are going through the same struggle?
I mean, for me, I would say, block it all out. That was one of the things I had to learn to do. My pressure wasn't from family. Like I said, it was society. And I would tell you for free, it broke me down. People will stop me. They don't know me from anywhere. Maybe because you see me somewhere familiar and you're like, oh, what are you waiting for? Doctor, why are you wasting time now? Your child is no longer small. What are you waiting for? And I had just maybe gone through one premenstrual syndrome, full symptoms. And I ended up having a period. And I'm dealing with it. I'm crying inside, I'm broken. And I come and this is what you're telling me. I had to get to the point where this conversation is no matter anymore. I had to block it all out. Now, for some women, it would be family. It might be their spouses, and you have to come to that point where you can feel comfortable in yourself, because even stress is enough for your hormones to go out of whack. And you have to find out what your problem is. Who is the person putting you under that pressure? For me, it was society. For the next person, it might be family. And until you're able to get that all behind you and just focus on what you want. And sometimes maybe you're not ready to you're not ready to have the child at that point in time. Yes. And you might try so much and it won't work. So just chill. It's okay to just let it go for a bit. And when you are ready, it has to be at your own time. For me right now, I'm just, enjoying the moments. When I'm mentally ready, I will do it. There's no pressure. The whole thing about you're a woman, you're not getting any younger,
You already have a child.
Do you understand? No, but for some people, they don't have at all. But the pressure alone is enough for you not to get pregnant out of, stress and all that. So sometimes it's just okay to just relax. It's difficult because people are going to say stuff about you. They're going to talk to you like they know what you're going through. But for me, I would say just block it all out.
So, in most parts of the world, commonly in African countries, I would say there's a very poor health-seeking behavior.
Yes.
And the reason I'm coming to that is because even though a lot of women are going through this issue or having these issues, they've not bothered to do a check. It's just like, oh, I'm trying, but it's not happening. But they've not actually taken the time to painstakingly, just like you've done, try to even identify if there's a problem. Because to some people, they're in denial about what their issues are.
Yeah.
You understand? They're like, oh, I don't have a problem. It's not me.
Yeah.
So and it can go both ways. It can go on the part of your partner as the guy or yourself. And the husband says, oh, I don't have a problem. Because generally in the world, once you say infertility, everybody tilts towards the woman.
Yes.
But in most cases, 1/3 is the man, 1/3 is the woman, 1/3 is just unknown factors. Because you can do, like you said earlier, you will do all the checks. You will cross all the T's, dot all the I's, and nothing will still happen. So now from my question is now, that previous question was from a mother's point of view, from a woman's point of view. From a doctor's point of view, what would be your recommendations? Now we know that you're supposed to do those checks, especially when you're of a certain age.
Yes.
If you're above 35, you don't need to be seeking to have a child before you check yourself. Those things are mandatory. Is as normal as the air that you breathe. So that before you get to the point of even trying to conceive, okay, there's possibly a problem. Let me explore my options.
Yes.
So now as a doctor that has gone through this and is going through it, what are your recommendations for women?
Well, for me, I would say, number one, if you have a partner or if you're single and you want to conceive for any reason, or even maybe you're preparing yourself to conceive, the first thing is be sure you want to have a child. Let's understand that, okay, you and your partner should have that. Yes, have that conversation. You guys want to have a child. So now this is not happening. Both of you have to come to that understanding that, okay, it is both of us. And if it happens that when you go do the test, or is this other person, show support, that's not the time for you to criticize. But the first thing you need to do is seek help. But you have to have been having adequate, unprotected sex with proper, I'm not sure if I'm supposed to say that. But you know what I mean. It has
if
to
you're having
be.
Sex, you should know what.
Yes, it's point and shoot, literally. Yeah. So you must make sure you're crossing that line, and don't come and say I had sex once a month and you're saying you're trying to conceive. No, at least 2 to 3 times a week. So if you know you've done all of that, it's not happening, go to the doctor. The earlier, the better. Because when you go to seek help, you will be able to find out if there's a problem and you'll be able to solve the problem. Sometimes the earlier you go there, the faster you can solve the problem. Sometimes also things will be beyond your control that you now have to seek, more medical help, or, there's so many options, surrogacy, IVFs and all that. So there's nothing that can't be handled if you seek help first. And do not hide it. Some women feel ashamed when, they find out that, maybe they have a problem. No. Speak to someone, whoever you think can help you. And there's so many organizations, NGOs and all that would give you a lending hand. I would lend you a hand and say, okay, what do you want to do? How do you want to go about it? And if everything fails, you can adopt. This is 2024. There's no reason why you cannot adopt a child and that child will not be your own. I mean, no one is going to, I don't understand, especially in Africa, there's so much, stigma against adoption, but it's perfectly normal. So you can do that if that's what has to happen, but you need to seek help and you can only do that if you speak out.
A lot of things have been said today, and I think it's usually easier and it's best when people hear it from somebody that is going through the same thing, because it's relatable.
Yes. A
lot of women would not even have the courage to speak up and say, oh, I'm struggling to have a child. when they come out to the society, they say, oh, there's nothing wrong with me. I don't know why I'm not having a child. I'm not sure why I'm not conceiving. But like you rightly pointed out, and I'm re-emphasizing, once you are ready or you are thinking of the idea of conception, you need to be sure that your body is ready and your mind is ready. Very important. We know that the pressure is real. The pressure is real. And the easiest thing, aside the tubal issues, the genetic factors, the easiest thing that can easily cause infertility in women is stress.
Yes.
Once there's a stressor, your hormones are going to be out of place. Once that happens, even the slightest change for some people is enough to cause difficulty with conception. So before you even think far and say you want to go consider the idea of IVF, there's nothing wrong with that. It's an option. It's open to you. Like we say, there's so many options. There's surrogacy. For some women above 40, 45, your body wouldn't easily carry pregnancy like you would in your 20s or in your early 30s. So that option should be open to you to say, oh, you know what, I'm going to have somebody carry the child. But like we always say, there are stigmas in some parts of the world. And we have to realize that these things exist. And that's the reason why a lot of women do not come out to talk about it. You're not the only one going through it. There's you and a million other women. So some of you is that you've never had children. Some of you have never even conceived. Some of you have had children and are struggling, regardless of what the issue is. The solution is pretty much the same. Know what the problem is, and you can only know the problem when you start trying to identify the problem. Yes. And I can imagine for you, because people always say, oh, even a doctor, you're a doctor, why don't you have it? Because people come to you, oh, doctor, I've been trying to get pregnant, and you're looking at them like, I know, I'm on the same boat as you. Because people are saying, oh, you're a doctor. You have solution for people, you should have a solution for me.
Yes.
So I can imagine, how does that feel when people come up to you and they be like, oh, Dr. Lule, see, I really want to confide in you. I want to talk to you as my doctor. I feel like I need to get pregnant, but it's not happening. So what do you advise? What are you thinking in your head when that happens?
I remember I was going through it, and a lady came to me with her husband, and they were talking to me. And I'm just like, God, I really don't want to do this right now. I've had it, and she was talking, and I'm advising her. And I'm looking at myself, I'm like, but I have tried all of this that I'm saying, and it didn't work, and there was that moment of doubt, like, do I not know what I'm saying, or am I buzzing, but then she was glad. Funny story, she's pregnant now.
Oh, wow.
Yes. So imagine the irony. So I told,
maybe I'm the one that has a problem.
Yes, and she was very glad. She was like, oh, thank you. But I'm like, so what is the problem? What is the real issue? Why not me? Sometimes it's hard. It's hard, especially when it works. And then I'm like, okay, that means there's something I know that works, but it's just not So that's the hardest part for me sometimes.
Okay, so we've heard it from a very personal perspective, and we've also dabbled a little bit into the medical parts of it. But I just really wanted to hear from somebody who had been through it. I'm really glad she came. I hope a lot of you can relate. I hope that you were able to get some information that will be helpful to you on your journey. And as always, if you have questions, if you have comments regarding what we've just talked about, you just go right to the comment section and leave a comment. And of course, I'll always get back to you.